Hello everyone, my name is Austin Carmen and this is my Nurse 301 Healthcare Policy Public Issue Project. My topic for this project is homelessness in Omaha. Although my topic is specifically about the homeless population within the Omaha area, I will actually have some information that I will share that will be more about the general homelessness throughout the United States. I chose to go with this format of making this into a video because I thought it'd be kind of fun to work on rather than a paper or creating some slides, especially since I wanted something fun during these final weeks of the semester. So, to begin this presentation, I would like to begin with the definition of homelessness. The definition of homelessness that I will be using throughout this presentation is that this is a condition in which an individual or family lacks a fixed, regular nighttime residence. They may reside in a public or private residence that is not designed or intended to be for a regular sleeping accommodation, especially if it is not meant for human beings. They may live in a supervised shelter designated for temporary living arrangements, and they could be in an imminent risk of losing their housing or have no subsequent residents identified or any resources able to obtain any other permanent housing. So in this presentation, we will discuss the scope, the duration, the history, the demographics, the causes, the resources, any laws and policies related to the topic, government agencies, interest groups, and nonprofits, potential solutions, and then I will finish up this presentation with a discussion of a research article that I found. So, now that we know what homelessness is, how widespread is this issue? So, on a single night in 2023, there's roughly around 653,000 people, or about 20 of every 10,000 people, homeless in the United States. So 6 in 10 people were experiencing what we call sheltered homeless. So they had either an emergency shelter, they were living in a transitional housing place, or they were in a safe haven program. So they had some sort of shelter. The remaining 4 in 10 were experiencing unsheltered homelessness in places that were not meant for human habitation. So they were living somewhere where they should not be. As mandated by the federal government, Nebraska is required to have a point count, so keeping track of how many people are homeless and all the surrounding description of that. It was noticed that since 2019, there had been a steady trend going up of unsheltered individuals, so people not living in that housing situation. In 2019, it was about 46 individuals, and then in 2023 there was around 200, as discussed by Jason Fieldhouse, who is the executive director of the metro area for care of the homeless. Fieldhouse also talked about the conversation of the burden that has been placed upon individuals due to the increased inflation, which has sent a lot of folks into homelessness, unfortunately. And then he also said that during COVID-19, the pandemic, they actually were given more tools to work with and more resources to give to those that are facing housing struggles. However, a lot of that aid has now dried up, so the number of unhoused individuals is unfortunately going up again. Now, fortunately for Nebraska, when looking at the overall homeless population, it has significantly dropped in the last decade, so that is a good thing. So on a night in 2007, the state's homeless population was around 3,500 people, and then in 2022, that total had fallen to 2,250 people, which is around like a 35% decrease, which is great. However, this is still a relevant issue, and I think homelessness still needs to be discussed here in Omaha. So how long has homelessness been an issue in Omaha? So homelessness by no means is a new phenomenon. The period between the Civil War and World War I, actually, for an example, they witnessed a large increase in men who had followed an active labor market, and they formed a highly visible sub-community which had gained the name of homeless individuals. Today's homeless population, however, does include more women, children, and minorities, with fewer single men and drifters than previous populations. In addition, to changes in the demographic composition of the homeless population, in my research, I actually found that most experts agree that the problem of homelessness has only been increasing. Since the early 1980s, homelessness has become a more visible issue. Homelessness has struck a responsive chord within society, and has attracted a lot of media coverage and political attention. Recently, the number of advocates for the homeless population has increased noticeably, so that's great. The activism of this issue has intensified, causing an increased public sympathy and concern for this problem, which generates controversy and disagreement over solutions in the exact size of the problem. So let's talk a little bit more about the history of homelessness, now specifically within the Omaha area, and paint a picture of what we truly need to know to understand homelessness and its history. So in 1850, people were pouring into the Nebraska territory, and living quarters were at a premium everywhere, especially in booming towns such as Omaha. Nebraska was new and had to be built up from the ground. Then, too, there was the complicated situation of lack of building materials and a shortage of labor, and individuals still had to house hunt in order to truly find a permanent living situation. In the 1930s, the city of Omaha first created a informal housing authority meant to address the housing needs of low-income immigrants who had traveled to Nebraska for job opportunities. The public housing was introduced in Omaha in 1937 when the Federal Housing Act was passed. This act actually made it able for federal loans for the city to be used for construction of low-income public housing. And then also around this time, the Omaha Housing Authority, or OHA, was formed and became the government entity responsible for the planning, construction, and maintenance of the city's public housing efforts. In 1966, they began to change their priority of low-income public housing. So initially, it was just about getting a place for people to live, and then it changed to starting to provide furniture, food, clothing, all those basic necessities that we didn't really think about. So starting in 1966, there was the first OHA tenant relations director that started to actually meet those needs. In September 1994, on the 21st, the Nebraskan Commission on Housing and Homelessness, NCHH, was formed, and the council was charged to focus attention on and increase awareness of the needs for homeless families and individuals in Nebraska. This council actually looked to encourage continuity, coordination, and cooperation among the state agencies and homeless service providers, so getting them to work together. They coordinated and developed a statewide comprehensive plan that established a method of that counting the number of types and causes for the homeless and near homeless individuals. The council then provided an inventory of agencies and service providers as resources to whoever may need those. And then they also established common terms and definitions for data gathering and program description, so everybody had the same definitions and terms throughout. Another task that was given to the NCHH was actually to serve as a advisory body to the governor on issues for homelessness. So there was somebody within that higher up political advocating for homelessness, which is very cool. Nationwide, men are more likely to experience homelessness than women, and rates of homelessness tend to be higher among historically marginalized racial groups. Percentages from the U.S. Integrity Council on Homelessness show that in 2022, non-Hispanic white individuals make up half of the total when discussing the impact of homelessness. However, non-Hispanic, Black, and Hispanic Latino individuals are noted to have similarly large percentages, with most people of color being overrepresented in the homeless population. Another graph I found details the type of individuals who are homeless. This is from the National Alliance to End Homeless, specifically in the Omaha area in 2018. And then on a national scale, 61% of the homeless were staying in sheltered locations, with the remainder, more than 226,000 people, being in unsheltered locations on the street, living in abandoned buildings or other places that are not suitable for human habitation. The increase in unsheltered homeless is driven largely by an increase in California, which is just a little fun fact there. In 2020, there were actually 171,000 people and families with children experiencing homelessness. A total of 3,500, almost 3,600 homeless people were children under the age of 18 without an adult present in 2020. And then also veterans comprised 8% of all homeless adults. Over 46,000 veterans struggle with homelessness. And all around, people of color are overrepresented in the homeless population. So even in the United States on a national scale, the people of color are at a higher percentage. Now, housing is a human right. I don't think anybody can argue that, but millions lack this basic right. So, what is causing this? And there are many reasons why someone may be homeless. So let's take a look at a couple of these issues. So, we have stagnant wages. While the cost of living increases, wages have not. In the United States, the minimum wage has gone up around 350% since 1970. Now, the consumer price index has increased by over 480%. So that is 130% difference. Unemployment. While low wages contribute to homelessness, unemployment is also a significant factor. There is the lack of affordable housing. Not being able to afford housing, of course, causes homelessness. Lack of affordable healthcare. Healthcare is very expensive, but many people are uninsured or underinsured, which means spending larger amounts of money on healthcare when struggling to pay for rent, food, and utilities. There is a lack of affordable care and health resources, which is even more important for individuals who have substance abuse problems or mental health issues, because those individuals are at an increased risk for homelessness. Poverty on a global scale. Poverty is one of the most significant root causes of homelessness. Stagnant wages, unemployment, high housing, and healthcare costs all play into poverty. Racial inequality. In the United States, racial minorities experience homelessness at a higher rate than the white population. Domestic violence or family conflict. Women and children are especially vulnerable to violence-triggered homelessness, and just conflict in the family has been shown to lead to homelessness. And of course, while homelessness can occur because of an individual's or family's circumstances, in this presentation, I will not ignore that there is some systemic failures of society just failing to identify and support people at risk of becoming unhoused. And there's failures in areas such as correctional services, healthcare services, and child welfare, where they are just failing to identify and support these individuals. A society's failure to address and especially racial inequalities, increased wages, and affordable housing will contribute to the homeless rates. So there are many current resources available. The Nebraska Homeless Assistance Program, NHAP, and Development, HUD, Emergency Solutions Grant, ESG, to assist the prevention and alleviation of homelessness. NHAP funds are allocated to nonprofit agencies throughout the state of Nebraska and are used in conjunction with other state and federal funds to provide services to people who are at risk of homelessness or are currently homeless. So these programs provided through NHAP and other homeless assistance funding include a homeless prevention, which overall just looks at rental financial assistance and services to prevent eligible individuals and families from becoming homeless. There's actually a tenant-based rental assistance program which provides up to 24 months of rental assistance for households. And of course, there's the Emergency Solutions Grant, which is a formula-funded program for allocating funds to assist people with quickly regaining stability and permanent housing after experiencing a housing crisis or homelessness. The city of Omaha works during these times with these individuals to ensure the prevention of homelessness, and they work towards enabling a homeless individual with independent living. Another resource is Rapid Rehousing, which is a rental financial assistance and services that connect eligible individuals and families who are homeless with permanent housing destinations. And then street outreach. So there's the essential emergency services that assist families that are residing in a place that is not designated for regular sleeping accommodations, and most of the time they're sent to like an emergency shelter, which is a short-term temporary living arrangement for homeless individuals. Now, what is in place governing this issue? So, the Nebraska Department of Health and Human Services funds all of the areas of the state with the Homeless Shelter Assistance Trust Fund dollars. The Homeless Shelter Assistance Trust Fund dollars is a state funding that is based on a 25-cent that is set aside on each $1,000 with regards to the value of real estate sold in Nebraska, and then this fund is collected via the tax stamp on real estate sales. So allocations of this fund are determined using a minimum funding amount of all regions, population base, poverty data, and a pro rate percentage, which allows for an emphasis in equitable distribution. There are several federal agencies that have programs serving those experiencing or at risk of homelessness. However, these agencies, through my research, have been shown to have areas where they can improve with how they implement their programs. For instance, so there's the Department of Housing and Urban Development, HUD, which is the main federal agency that works to address homelessness. It provides funding for emergency shelters, permanent housing, and transitional housing. In the event of a disaster, many individuals are severely affected and some become homeless, live in shelters, or live on the streets. The HUD and the Federal Emergency Management Agency, so FEMA, provide funding to state and local governments that can help assist the homeless populations during a disaster. However, it has been noticed that HUD and FEMA don't regularly work together on homeless housing issues during disasters. So having them work together would be a more adequate kind of help there with government agencies. HUD also collects data on homelessness to assist with planning services for the population. So they help with planning, which is one of their jobs. However, HUD's point-in-time count, which is how they count people experiencing homelessness on a single night, and I discussed it earlier in this presentation with how Nebraska is required to do so, may actually be underestimating the homeless population because they, of course, are not going to find everybody when going out and asking people on a single night who is experiencing homelessness. And then the HUD and Department of Health and Human Services, HHS, provide grants to local organizations to operate youth homelessness programs like shelters and transitional living programs. However, many youth who are homeless may not be receiving these services for which they are eligible for due to a lack of guidance from these federal agencies on how to access these services. And then finally, the U.S. Interagency Council on Homelessness coordinates the federal response to homelessness. The council had developed a strategic plan that benchmarks for ending veteran homelessness and chronic homelessness. Yet, the flaw with this council is that they don't have a great clarification of its role and responsibilities, nor what is required of the individuals to meet these policies or procedures. So, those are a couple of the government agencies that are available that address this issue. However, there are many flaws within the system. There are some interest groups and nonprofits in the Omaha, Nebraska area. A couple of these groups include the Open Door Mission, which the location has overnight lodging, food, clothing, and laundry that is provided to families and single individuals. They also support the general public by providing food, clothing, medical care, and education training. There's the Habitat of Humanity, which is dedicated to eliminating substandard housing and homelessness, and they're trying to make more adequate, affordable shelter more accessible. We have the Project Houseworks, which has looked into enhancing lives and strengthening communities by preserving and creating high-quality, affordable housing. And then we have the Youth Emergency Services, which is also known as YES or YES, and the mission of YES is to serve homeless and at-risk youth by providing critically needed resources that empower them to be more self-sufficient. So, during my research of homelessness in Omaha, I have generated two solutions. So, my first solution is looking at a solution that is already created, and that is to increase rapid rehousing. So currently, rapid rehousing is a short-term rental assistance with some services. The solution is to look into how to increase the number of houses that can be used for these individuals and how to team up with other organizations to have more eligibility for the individuals in these programs, and how we can just get more people into the rapid rehousing circumstances. Plus, it would be interesting to see if there would be a way to lengthen the amount of time for the rental assistance. And by far, throughout all the articles and stuff that I had read, this intervention had been seen to be effective, and it is known to be the primary solution for ending homelessness. So I would just like to see this increased in Omaha and see how much more could be done with this solution. My solution, too, is that Omaha currently, from my research I didn't see, has no city-run homeless shelter. So there is a lot of, or not a lot, there's a few privately run homeless shelters in the city, but they are constantly overcrowded. According to the Open Door mission, they see around 2,000 people homeless about every night, and this causes many homeless people to be seen sleeping in their cars outside of the homeless shelter, or there's elsewhere, because they are so full. So many homeless shelters are not, another flaw is many homeless shelters are not inclusive to all homeless people, nor do they provide enough services for all the homeless individuals that come to their location to get out of homelessness or poverty. So the solution I would like to propose would be for Omaha to build a multi-purpose facility for an inclusive citywide, city-owned and operated homeless shelter with space for many different facilities, such as maybe a health center, education and job training center, soup kitchen, maybe even like a city employment office or housing office, all built in. So then they wouldn't have to go to different resources. They could just go to one place, get all the stuff they need, and not be unhoused anymore. The final portion of my presentation looks at the research article, which this research article that I will now be discussing is Homelessness and Public Health, a Focus on Strategies and Solutions, which was written in 2021 by David Sleets and Louis Franciscuti. This article discussed how we currently have an inadequate understanding of what drives homelessness and why individuals are living within or without adequate shelter. Although housing is one of the most researched social determinants of health, and there is the knowledge that shelter is a basic human need, housing remains the most critical factor for addressing homelessness. The strategies and solutions discussed in the article focused on approaches to providing temporary or permanent housing for those in need, and that the decrease in healthcare costs would be beneficial to ending homelessness. So as a future nurse, it kind of stood out to me when I read that some professionals would say that housing equates to health. If you improve housing options for homeless individuals and families, it advances the level of health for the population. So that was a really big takeaway with this article that I had read on this topic. And that brings me to the conclusion of my presentation. So thank you for watching. I have listed all of my references. These are the references that I used. All of the references are here. And thank you.